Well, welcome, Facebook Live viewers. My name is Brad Bodis, and we're here for our weekly Bond and Bodis Facebook Live event. I want to thank all of you that have been joining us. We try to cover important topics that are affecting people as we go through this current pandemic. Trying times for all of us. Just to begin, I want to remind all of you that the Bond and Bodis law offices are located throughout Alabama, Mississippi, and in the Knoxville area in Tennessee. We help people with money problems. We know a lot of you are having money problems, and we're offering absolutely free initial consultations by phone or video from the comfort of your home or office right now. So if you need help, please don't hesitate to reach out. But for today's Facebook Live episode, just absolutely thrilled to have a popular person right now. We have a board certified infectious disease specialist, Dr. David Riddle. Dr. Riddle, thanks for joining us today.
Thank you.
So I know you have given me permission to call you David, and I will, but Doctor, I have respect for you and the work that you and your colleagues are doing right now, and appreciate it. Just to share with our viewers a little bit about your background, as you and I were just discussing, you were actually born in Cambridge, England, but moved to the U.S. at a very young age. Your parents, you said, were both citizens of the U.S., and you then attended the University of Missouri, Columbia to get your undergraduate degree, went on to med school and did your residency at the University of Missouri School of Medicine. And then after that, you did a fellowship at the Washington University School of Medicine, which is, despite the name, it is in St. Louis. It's in Missouri also. But it's my understanding that that fellowship was both in internal medicine and in pediatric infectious diseases, so it was combined. Is that correct?
Yeah, so I did a residency in internal medicine and pediatrics at the University of Missouri. And we sort of created the fellowship opportunity there at Washington University with the department chairs at the time. So it was sort of a new thing that we had done, but essentially I did two fellowships just sort of mixed in together. So I no longer practice pediatrics, and so I let that certification lapse, but I do still have certification active in infectious diseases and internal medicine.
Well, I'm not a physician, but I know from talking to other physicians that doing a dual fellowship is quite a task, though. That must have been a tough time. But what else should we know about Dr. David Riddle? If you want to just introduce yourself to our visitors.
Sure. I think mainly now I practice internal medicine. I'm doing outpatient only, so we don't go into the hospital. I do still practice infectious diseases in terms of taking care of patients with HIV and bacterial infections, and we'll do some antibiotics through PICC lines for bone infections, that sort of thing from the clinic. But I think the perspective you'll be getting today is mainly going to be sort of general internal medicine advice that I plan to give to most of my patients in relation to the vaccine, as well as keeping themselves safe over the holidays. So I don't think we're going to have to worry about a whole lot of technical details from the infection standpoint. But I do think the training that I've had, I mean, I've worked in laboratories, both clinical and research laboratories, and so I can look at this data sort of from that perspective as well. Still, it's going to be just general advice that I would give to any patient I would see in clinic.
Well, David, I appreciate you being humble and saying just general advice, but it's not often many of us have the chance to actually ask questions to an infectious disease specialist and get the type of information I know that you're going to share today. David, this is kind of an interesting time. We've all been dealing with this pandemic for a number of months now, but we can see light on the horizon. There is a vaccine, or a series of vaccines, as I understand it, primarily two that we'll work with in our country. It's on the horizon, but we don't have it yet, and it'll take some time to roll out. At the same time, we see numbers peaking. I know hospitalization rates here in Birmingham, where you and I are located, and throughout the country are going up. And we've got holidays coming up. For many of us, Christmas, Hanukkah for others, New Year's, where people will be traveling and gathering. So although there's a light on the horizon, we need to be careful. I want to break this down. Let's first talk about the vaccine or vaccines themselves. So when can we expect the vaccines to be available, and who will be able to get them first?
So I expect the Pfizer vaccine probably to be available anytime now in the United States. This is the vaccine they started to use in Britain yesterday. I think they're applying to the FDA today to get this approved, and I don't see a reason why it wouldn't be approved. So I think that's going to be available, honestly, within the next few days. Unfortunately, the supplies are going to be very limited, and the first few vaccines that are going to be available are going to go to institutions. And so it's going to be nursing home patients, employees at nursing homes, and the folks in the hospitals, the ICUs, the ERs. As a healthcare worker, I do see patients that are infected with COVID, but I will not be one of the first people getting this vaccine. I would if it was offered, but I think it's going to go to the people that are dealing with coronavirus pretty much 5 to 7 days a week. And the rest of us probably are going to have to wait a few more months. Which I don't necessarily think is a terrible thing, honestly, because it does give us just a little bit more time to get more and more safety data. And so I think by the time it's available to the rest of us, maybe in February or March or a little bit after that, we should all be reassured that it's incredibly safe, and we won't have to be concerned about any unusual side effects popping up at that point.
But speaking of side effects, and I know this is a big concern for a lot of people, but as you said, the vaccine, they began giving it to people in Britain yesterday. And one of the first news stories was that there was a warning people perhaps with serious allergy problems should be cautious about the vaccine. Is that a big concern for most of us?
It really shouldn't be. It's my understanding from the news reporting so far that the two individuals that had reactions had known already severe reactions. I think it was to food, and they were reactions so bad that these folks usually carried around EpiPens. And so I think for those of us that usually don't have allergies to food, it probably won't be a problem. But they are reassessing giving it to folks with severe allergies in England. And I assume by the time it's available to the public here, we'll have a lot more information on that.
So this particular, the Pfizer vaccine, which you expect to be rolled out most quickly, as I understand it, has a 95% effective rate. Now, is that correct? And if so, as vaccines go, is that a high number, a low number, or how would you judge that effectiveness?
So that is correct. That's based on a little bit under 200 infections. And so I do expect as we get more and more infections, probably the numbers won't look as good. But even if you lower the effectiveness by a few percentage points, it's still outstanding. The minimum effectiveness that the FDA was going to accept at the beginning of the pandemic was 50-50. So having something be 90 is just unbelievable. We would be overjoyed with something 70. And so I think if we really do end up with something 80 to 90% effective once even more data is in, this is really going to be fantastic. And if there's a few people that choose not to get the vaccine, that won't be as much of a problem, since you do have to get a certain percentage of the population immune to help prevent outbreaks. And so right now, if we only had a 70% effective vaccine, we probably could not get enough people immune in the nation to prevent outbreaks. If we have something 90%, I of course would still encourage everyone to get that. But at least if you have a few people that refuse to get the vaccine, it's still likely that we'll not see as many outbreaks.
So you just referenced the people that may choose not to get the vaccine. You're aware there's an element of the population of folks that just are worried about taking not just this vaccine, but vaccines in general. Based upon your education, your experience, what would you say to those people that are nervous about taking vaccines?
Well, I think some folks you just simply can't convince, which is a shame. But from my training, from just general pediatrics to the infectious disease training, it's clear that vaccines work. Of course, the occasional issue is going to occur after someone is vaccinated, but when you actually look at the data, these things occur at random, regardless of getting a vaccine or not. And so I'm comfortable with the vaccines that are out there now in terms of being safe. I would recommend the currently available vaccines for things like pneumonia to be given to any of my patients. And I think really with the coronavirus vaccines, it's going to be a similar thing. By the time it's available to most people in the population, there's going to be millions of healthcare workers that are already immunized. And so the 1 in a million side effect we will probably already know about by the time it's available to the rest of us. And I think the safety concerns really by the time we can get it are going to be non-existent.
That's good to hear. You know, it's interesting to me, I'm not a physician, but people that have become ill with COVID certainly have been willing to try just about anything, including a variety of non-proving experimental drugs to save their lives. Well, these vaccines are designed to save people's lives, and they're certainly nowhere near as risky as a lot of the experimental drugs that have been out there. So I'm certainly going to get the vaccine as soon as it becomes available to me, and I sure hope others will. Folks, we need to beat this thing. The next big concern that I see that's on the immediate horizon, really we've already encountered it, is the large family gatherings that traditionally take place at this time of the year. We've already had Thanksgiving, we've got Christmas or Hanukkah and New Year's coming up. Let's start with this. Have we seen any peak with relation to Thanksgiving travel, or has there been enough time so far?
Honestly, it's hard to tell because things are just simply so bad right now. When it didn't really calm down very much, when we went from spring into summer, I think most of us became very worried that it wasn't going to slow down and accelerate once the cold weather hit again. And unfortunately, that has been the case. And so right now we're in another exponential growth phase where the numbers are just simply skyrocketing. Here in Alabama, we have more people in the hospital now than we ever have, including that terrible peak we had back at the end of July and early August. And so I'm sure Thanksgiving probably did play a role just because more people were getting together inside, and obviously you're not going to be wearing masks at the dinner table. But it's just very difficult to tell because things are just terrible across the board, and it's not just Alabama. It's, of course, the entire nation suffering from the same thing.
You say we're already at record highs. I've seen numbers that say that they're going to go even higher pretty dramatically over the next few weeks. What are the numbers? what kind of numbers are you seeing? What can be expected here in Alabama and elsewhere?
Well, the Alabama Department of Public Health site is quite good. It's updated daily, and you can find pretty much whatever number you would like on there. Some numbers are more important than others. What I follow is mainly the hospitalizations, because that number isn't necessarily going to rely on how many tests are being done. At the time when we had shortages and we weren't able to do as many tests as we like, it was a little bit hard to follow the positives, because you knew there were people out there who were positive but just simply weren't able to be tested. Whereas the hospital numbers are going to be accurate. The main problem with those, of course, is that the amount of folks in the hospital, those numbers are going to lag past the infection by about 2 weeks. And so it does give you a delay in knowing what's going on, but it's hard to argue with those numbers. So at our peak back in late July and early August, we got about 1,600 people in the hospital per day across the state. We're now about 2,100, and it doesn't show any sign of slowing down yet. That's very worrisome, because the hospital system is nearing capacity, and so we don't have a lot of extra space. Once that happens, of course, if you are the only state having an issue, you could always transfer patients out of state to other hospitals, but every state is having a problem right now, and so there's not going to be a lot of places that are able to accept your patients. And so once you run out of space in the hospitals in your state, unfortunately, that means people are probably not going to get hospital beds when they need them. The more high-risk patients are going to be stuck monitoring themselves at home. And unfortunately, that means there's probably going to be more deaths that otherwise wouldn't have happened.
You've said that in medical terminology, but people will actually be turned away from the hospitals, is what you're saying.
Yeah, I think that's a very real possibility over the next few months. You also not only have to worry about the beds, but the people who are actually taking care of patients in the hospital. The busier they get, the more patients they're exposed to, the more likely they are to get sick themselves. So you may end up with staffing shortages, both nurses and doctors being pushed to the limit and stretched very thin. And so this is not a good time to just say, well, I can catch coronavirus, I'll be fine. They can give me a medication and give me some oxygen in the hospital, and I'll recover and go home, because we just don't really have the capacity for us to behave that way and take risks now. I think the people that are working in the hospitals really need us all to do the best we can to keep safe, so that we don't need to go to the hospital and take up those precious beds.
It's interesting to me that you say you look, there's lots of information available, but you look at the number of hospitalizations. I hear that COVID numbers are up in the United States because we're doing more testing than anybody else. But the amount of testing wouldn't impact the number of hospitalizations, correct?
Correct. So, I mean, it is true, obviously, if you do more tests, you're going to find more patients. But there's plenty of other measures you can look at to know that things are bad, and it's not just increased testing. So percent positive tests, you can also look at to see if the incidence of coronavirus is going up, because that percent shouldn't increase as you're doing more testing. If you have a low prevalence in the community, that percent will actually go down as you do more testing, because you'll be testing more people that don't have the infection. And so we are also in a very bad place there as well. I think ever since May or June, we actually haven't been under 5% positive test rate here in the state. Right now in Jefferson County, we're about 15% positive testing. And I think across the board, if you just look at Alabama as a whole, we're more than 12%. So that's quite bad. You want it to be under 5% at least. Under 1% would be even better.
So This is a scary time, folks. We again, the light's on the horizon. The vaccine's out there. Numbers are going up. Hospitals are filling up, and we're approaching Christmas time. So, holiday gatherings, David. People are used to getting together with family. People are used to traveling at this time of the year. What kind of advice are you giving with respect to upcoming plans?
Advice no one wants to hear, I guess. I'm not going anywhere. It's my wife and I in the house, and that's going to be the two of us for Christmas. I'm not traveling to visit family. This will be the first time that I can remember that I haven't seen my mother for Christmas. It's obviously rough, but if the alternative is risking getting my family sick, then I think honestly it's a pretty easy decision for me to stay home and just to use Skype or some other program to connect with family. The CDC does have some questions you should think of if you're planning to visit family. Unfortunately, we already know the answer to several of those across the United States is not where we need it, and so if you follow the CDC advice, then it means you're also supposed to just stay home and not go out. So if you would like, I have those questions in front of me, which I'm happy to share. So the CDC would like us all before we travel to consider these things. And so are you or one of your relatives at higher risk for getting severe coronavirus infection, so immune compromise, age greater than 60 or greater than 80 being worse? Are the cases in your community high, or are the cases where you're going high? Unfortunately, the answer to that, if you're from Alabama, is yes, and most likely where you're going, it's also elevated. Are the hospitals overwhelmed or getting close to overwhelmed in your area or where you're going? Here in Alabama, I can say the answer to that is yes. Does your destination have some requirements for quarantine? That's something you'd have to check the local health department sites for. Have you been around anyone that may have been exposed to COVID? Think about that before you travel. If you have been potentially exposed to COVID, then honestly, you should stay home for at least 10 days, preferably 14, and just not see any family during that time. Think about how you're going to travel. Are you going to travel by yourself in a car, or are you going to take public transportation, airplanes? In those settings, you really can't stay 6 feet away from people, and so it's possible you could get exposed during your travel. If that's the case, then you may infect your relative after you arrive. And then are you going to be traveling with people you don't know? Again, if you're in your own vehicle, that's probably not a problem. But if you're around other folks, honestly, you're relying on them to do what's best to keep you safe. And not everyone is following the recommendations. And so if you can't trust the people you're around, then again, you could get infected during travel and take that to your relatives.
Yeah, folks, again, I'm not going to travel either. My mom lives in a different state. She's 92 years old. I haven't seen her in months. I'd love to go visit her over Christmas. We usually get together every year at Christmas. But the last thing I want to do is carry this virus to her. She's 92 years old. She doesn't need to deal with a virus like this. Let's be smart. David, some of us will participate in small gatherings, so there'll be a small group of people. Does it make sense to wear a mask when we're visiting with people indoors?
Yeah. At this point, the recommendation really is you don't necessarily have to wear masks if you're around folks that live in the same household. So obviously my wife and I don't wear masks in the house. But as soon as you start to interact with people that are outside of your household, the CDC does recommend that you follow the same advice you would follow if you were in a public place. wear masks, try to keep social distance. If you're going to get together, try to get together outside. Don't be cooped up for long periods of time in an indoor space, even with masks. That's risky. And so if you absolutely have to get together, just try to follow the usual safety guidelines during that time. If possible, just do things outside, stay apart as far as you can, wear masks when you have to be close. It's just, now is not the time to let our guards down since we're pretty much surrounded by coronavirus, no matter where you are, cities, rural areas. It's all around us. Any of us can get infected. And unfortunately, the frustrating thing with this virus is you may be contagious for a couple of days before you even have any idea that you're sick. You don't want to give this gift for the holidays. I think this is just the time where we need to be more cautious, realize that we're getting close. Next year's Christmas hopefully is going to be much more normal. And so if we can focus on the good things to come, as opposed to feeling too bad about having to hunker down and be by ourselves over the winter, then I think that's just the best thing for everyone.
So one of our earlier Facebook Live episodes featured one of your partners, Dr. Larry Gazzini. We did a lot of detail on masks and the importance of wearing masks. And by the way, viewers, this episode and all of our previous episodes are on the Bond and Botus Law Office Facebook page. If you know somebody that might benefit from this or one of our previous episodes, please share this with them or direct them to our page. The episode with Dr. Gazzini was very well received. A lot of people learned a lot from it, and we went into detail on masks. So I don't want to really go deep into that right now, other than I would like your response as an infectious disease doctor to those that say we don't need to wear masks, that they're not effective.
So it's very difficult to give you actual percentages of say, if you wear a mask, you're X amount less likely to spread the virus. It's just hard to get that data. But I think we have enough studies at this point to where it's very obvious wearing a mask keeps you from spewing virus in your respiratory particles further into the air. And does reduce the risk that you're going to pass it on to others. The CDC did update their guidance to also suggest that wearing a mask does reduce your risk for getting the infection a little bit. Again, that's hard to give you actual percentages about how much that improvement is. But I think the data is very clear that wearing the mask should help prevent you from accidentally passing the virus to other folks, especially during the time when you may not yet have symptoms.
And folks, you have nothing to lose by wearing a mask. I understand there are a few people that have health problems that might make it uncomfortable or difficult to do on a regular basis, but that's putting a piece of cloth on your face to protect the people you love and to protect your neighbors, something we're charged to do. So again, it's not for much longer, but people, let's put on the masks. David, the last general topic I wanted to discuss before we get into questions, and by the way, viewers, if you do have questions for Dr. Riddle, some have already come in, but feel free to post them here and we'll try to get to them before this episode is over. David, we have not yet seen them here in Alabama, but we are in other parts of the country, but new round of shutdown orders and restrictions. I'm a bankruptcy attorney. I know the impact that those shutdowns can have on small businesses and upon people that may lose their jobs. But why do we have these shutdown orders and why are they important?
So once you reach a certain level of virus in the community, it's just going to take off. If you imagine, say, compare the virus to a wildfire, and all of us are dry blades of grass, It doesn't take much for a small area to just annihilate an entire field. And so right now we're at that stage where there's pretty much virus all around us. Any one of us could pick it up and then accidentally pass it to several other people, and it just takes off. So the shutdowns, what they're designed to do is just keep us all at home so that we're just simply not going to give the virus to other people. They work, but obviously they're extremely painful, and no one likes them. The sad thing is that shutdowns, we learned a lot during the first one, I think, and we have more data since that time. And so shutdowns really would not be necessary if we just all got on the same page, wore the masks, try to not go out unless you need to. You can support your local restaurant by picking up food and taking it home. So there are ways to still participate in the economy. If you can just wear the mask, keep the distance, then that would probably be enough most of the time to keep the virus levels low enough in the community that a shutdown would not be necessary. I don't think we're going to get another shutdown in Alabama just because obviously the first one was so painful and not popular. But I know in some of the other hotspots, New York, again, they're doing some, in California, doing some more focal shutdowns. But the reason for that is when you just simply can't handle any more virus, you can't take any more patients into the hospital, and you absolutely have to stop transmission. That's when the shutdowns actually would need to occur. It's unfortunate we get to the point to where we need them. If we could just all do the right thing, then we would likely keep the virus transmission low enough in the community that a shutdown would not be necessary.
Well, if it is necessary here in Alabama, it will be because situations have gotten very dire, I'm sure. Our political, state, and local leaders do not want to implement a shutdown order. So, folks, if it happens, it's serious. And we're talking life and death for a lot of the people we love, people in our community. I want to get into some questions we've had come in here. Before I do so, just to remind our viewers, I'm Brad Bodis, and I'm an attorney with the Bond and Bodis Law Offices. We have offices throughout Alabama, throughout Mississippi. We're in Knoxville, Tennessee, and we help people with money problems. We know that a lot of people are going through tough financial times right now. If you are, get advice, be proactive, reach out for help. All of our offices are offering absolutely free initial consultations right now, and we'll do them from the safety and the comfort of your own home or office. We'll do them by phone or video, but reach out and get help. Know what your options are as we're going through tough times. Let's help each other out. We do this Facebook Live event every Wednesday at 1 o'clock Central Time, 1 o'clock p.m. Central Standard Time. And we try to feature items of interest. Today is particularly interesting in that we're thrilled to have an infectious disease doctor, the heroes right now, the people that were that are guiding us through this pandemic. Dr. David Riddle, who's a physician here with internal medicine specialists in Homewood, which is just outside of Birmingham, Alabama. He's the second physician from that practice that's been kind and generous to share information with us. Dr. Larry Guzzini joined us just a couple of months back to talk about the importance of wearing masks. All of these episodes live on our Facebook page and on our website. So if you know somebody that might benefit from them, please refer them back here. David, we have a couple of questions here, so I want to dive into these. So the first question I have here is it important to get tested for COVID regularly? I hadn't even thought. I guess it is for some, but tell me your thoughts on the importance of being tested regularly.
So testing, I think, is actually fairly complicated, especially if you watched the news sort of early in the pandemic. There was a lot of concern that we just simply could not test early on. That was definitely true, but I think that wasn't always explained well. And so I think there's the testing where they were saying we need to test several million people across the United States on a daily basis. What they were mainly referring to is more of a surveillance type testing where you're testing asymptomatic people. You're trying to find the infections in the community so that you can sort of identify spaces where the incidence is increasing. You can target your interventions to that specific area and try to slow the spread. You can do contact tracing on those folks and that sort of thing. And so I think for that, that's fantastic to be able to do that when the incidence of the infection is already generally pretty low, so that you can identify the hotspots and stop them before they get worse. Right now, we know it's bad everywhere, and so surveillance testing isn't really going to be that helpful. We just know we're pretty well surrounded by it. It doesn't matter where you are, COVID is in your community. And so surveillance testing at this point isn't too helpful. The numbers are just way too high to be able to contact trace, and so things are just frankly out of hand. And so now most of the testing is going to be geared towards people who have symptoms to either prove that they have COVID or something else, or it's going to be geared towards people who may, someone who needs to leave quarantine if they've been exposed, then you can test them to show that they didn't or did get infected. And so I'm not a believer in just having someone get tested once a week. I think actually that gives folks a false sense of security. The testing is not perfect, especially the rapid testing. You can have a fair amount of false negatives. COVID is very strange also in that some folks don't have a lot of respiratory symptoms, and we've seen a few cases where they've had significant other symptoms such as diarrhea or gastrointestinal problems. They have tested negative when you've done the standard respiratory swab. They may test positive if you test the stool or you wait and test the antibodies later. So I think at this point, you don't necessarily need to worry about how much testing is done. I wouldn't just routinely screen asymptomatic people unless, if they're an employee at a nursing home or something along those lines. I personally have never been tested for COVID since I have been asymptomatic. I just mainly assume that I may be infected, and I do what I can to keep that spread, which is wear the mask. Don't do anything unnecessary where I may expose my patients. And so I think if you're able to do that, if you can isolate at home, if you're going to wear the mask and behave, if you're asymptomatic, you probably don't need to be tested. If you have had an exposure and you really have to know, if you're an essential worker and you need to know that you're negative, then I think in those situations it's fine to be tested. Right now, with the way the recommendations are, there's that recent change that if you were exposed to someone with coronavirus, then they would like you to isolate for 7 days. If you have a negative test at around day 6, day 7, you can consider yourself in the clear and leave quarantine. The previous recommendation was you isolate for 14 days, and so that does use the test to help cut the quarantine time in half. And so there are certainly those situations where the testing is very helpful. But in terms of just assuming we need to blanketly test millions of people across the United States for surveillance at this point, that's long gone. We simply can't do testing like that anymore. Now we have to take the tests and use them for people that have symptoms.
With everything I've heard about this and all of the talk back and forth, you just said something I've never heard, and it's so wise, and that is, if I understood you correctly, whether or not you've tested positive, behave like you have, assume that you're contagious and do what you can to protect the people around you. Makes great sense. David, with COVID, I've heard a lot of people say, well, boy, I think I probably had it earlier this year. I went through a period of time when I was tired and I had some congestion problems. I see these tests available to be tested for the antibody. What's going on there, and is that beneficial for people to do?
The antibody testing, I think, is actually fairly reliable for the most part. It's not going to tell you, though, if you have COVID at the time. It looks for the antibody response to the virus, and so that's probably going to take a minimum of 2, more likely 3 weeks before it's obvious. And so by that time, you are no longer contagious. So you can't really use the antibody testing to find out if you're sick. It's more to prove that you had an infection in the past. So I think that is helpful. Unfortunately, there have been some fairly convincing reports of people getting reinfected. And so even though that does appear to be quite rare, I would not use the antibody test to say, look, I'm immune, I can run out and do whatever I want because I'm not going to get infected again. I think that's a bridge too far. So even in the folks that have positive antibodies, we assume they probably will not get infected within 3 months. But I would still ask them to do the same as the rest of us, wear the mask and just be as cautious as possible.
So for Don that just asked a question here, can you test 8 months after a possible case to find if you had it? That would be the antibody test.
Oh, yes. And that has been helpful in some of the patients, like I mentioned, that only had the gastrointestinal symptoms. When the respiratory swab is negative, you just wait a few weeks, do the antibody test, and it will confirm whether it was COVID or not.
Next question here. My sons continue to play sports. Is our family at a higher risk of contracting the virus? Says after holidays, but I think just in general. What's your advice there?
So the CDC actually does have some sort of vague advice in that area as well. Unfortunately, there's no, again, specific percentage where I can say you're 50% likely to catch COVID if your child plays sports. There's way too many unknowns. But definitely some sports are going to be worse than others. So say tennis, for example, where you're relatively far away from the other player, probably pretty low risk. The contact sports, wrestling or something like that, where you're right up next to someone and huffing and puffing and breathing in their face, that's going to be a fairly high risk. But the CDC has 5 categories which start at low risk and then just go to high. And again, there's no percentages there. But the low risk is going to be practicing sports at home. Obviously, you're not exposed to other people. And so if you're doing some gymnastics in your basement or something like that, then your risk is not going to be any higher than anyone else. The next level is if you're practicing as a team, you're practicing together, but you're not actually competing. So something like tossing a football back and forth or something along those lines would also be generally low risk, but obviously higher than doing something at home. The next level would be doing something competitive, but still being in the same team. So if you have a football team, splitting it in half, having them compete against each other, that is going to be slightly higher risk because, again, you're going to have people getting close together. Possibly, during a tackle, you could certainly accidentally come in contact with some respiratory droplets, etc. But still, you're sort of in your own clique. You're not coming into contact with people out of your area, so that's probably about the middle risk category. The next would be doing some sort of competitive activity with a different team. So now you've expanded the number of people you've come in contact with. You've expanded the circle from which you're getting those people from, and so that's going to start to be fairly high risk. And then the highest risk is being in a competitive activity with someone outside of your own area. So if you're competing with someone from a different county or a different state, you are potentially bringing in virus from that area. And then again, respiratory droplets could certainly come in contact with it. You could inhale something, and that's considered to be pretty high risk. And so if your child is involved in that sort of activity, that would be even more reason to really reconsider taking that child to go see grandma for Christmas.
For adults, sports like golf, I assume it would be one that would be on the safer side right now.
Fairly low risk, yeah, and unless you're getting together with a large group of people and talking on the golf course. If you're out there by yourself on the field with no one within 6 feet, you're probably pretty safe. So yes, feel free to golf.
All right, well, good. That's good news. I have a question here from Jim. Jim's question is, once you get the vaccine, how long before it's effective, and should I keep wearing masks after getting the vaccine?
So there are more than 100 vaccines in development. And the answer sort of depends on which vaccine you're talking about. I think the vaccines that are closest to coming out are the Pfizer, the Moderna, and the AstraZeneca. So Pfizer is the one that they started using in England, and I assume we'll be vaccinating within the next week here with that one. So that's one of the vaccines that's very effective. Is probably about 94-95% effective. It requires 2 doses. And so I think the data shows with the Moderna and the Pfizer vaccines, which are fairly similar, that after the first dose, you maybe have a 50% chance to develop a significant immunity. The second dose is what really boosts your immunity up to the 90-95 area. And so after that first dose, I would not assume that you're safe. I would certainly continue to wear masks. The second dose, typically we assume that it's going to take at least a week, probably 2, before you really reach full immunity after that. So I would still continue to wear a mask and social distance and just be as cautious as possible for a minimum of 2 weeks after the vaccine. The other issue, which we just simply can't answer right now, honestly, is really how long is this immunity going to last? And so we think with natural infection, probably 3 months is a good guess. Hopefully with the vaccine, it's going to be much longer than that. But honestly, that's still up in the air. So it's possible that this mask issue is going to linger. If you have an outbreak occurring in your community in the summer, maybe there will be a mask mandate that would occur during that time. And then when the incidence drops again, we can ditch the masks. So it's possible that the masks are not going to be completely gone anytime soon. But I do think with these vaccines, there will be a significant return to some version of something normal that kind of resembles where we were last year.
So, yeah, I've heard from a number of sources what you just said, that this first vaccine, there are 2 shots. I know the shingles vaccine, the shots had to be several months apart. What's the timing with this vaccine as to the shots?
So both the Moderna and the Pfizer vaccines are 28 days. Okay. Some of the vaccines in development are single dose shots, and so these they're less effective. Right now, the AstraZeneca one is an example. It's probably about 70% effective. So definitely, if I had to choose, I would want the Pfizer or the Moderna vaccine. The single dose shots, those are going to be more helpful for situations where you just have trouble getting folks medical care. So if you only have one chance to see someone all year, then the AstraZeneca shot that's going to give you 70% immunity, definitely better than nothing at all. And so I don't think those vaccines are going to be that common. I do think they'll be available in the United States, but the single shots, they are highly likely to be less effective than the 2-shot vaccines.
So many of us are used to getting a flu vaccine annually. How will that work with COVID? Will there be additional shots needed on a regular basis, or will it be pulled into that flu vaccine, or how will that work?
We don't know. I think all of us are optimistic, especially with how good these vaccines are looking in the early days here, that you'll get the vaccine, you'll get the 2 doses separated by 28 days, and then COVID is going to disappear once we all are able to get enough immunity going around in the community. Honestly, it's possible that that COVID-19 could change, and it will become a seasonal pattern. We haven't seen a lot of evidence with that yet. I think the main mutation that seemed to have occurred so far was making it just slightly more contagious. So I'm optimistic. I mean, things like SARS and MERS, the previous viruses that are probably most similar to this one, they did not have major shifts like we see with the flu. So I think we can be optimistic that it's going to be a one and done thing. But honestly, we need more time to know for sure.
David, we hear the term herd immunity floated around quite a bit. What is herd immunity, and will it eventually keep COVID from being a concern for most of us?
So herd immunity is certainly the goal. Really, what herd immunity is the concept that if enough of us in the community are immune, then there are going to be a few of us that are not. And so if I'm already immune, I can't get the infection again, and I can't spread it to somebody else. And so there may be someone who's vulnerable who can't get the vaccine, or someone who doesn't respond to the vaccine, because there will always be non-responders, that they will still be safe because I am immune. And so there just simply won't be enough people around them that would have the virus that would spread it to them. And so that's the goal. The main argument is how you get there. And so some folks, not many, but some were advocating for just letting COVID run rampant throughout the nation and develop herd immunity through natural infection. That is a very bad idea. We would probably end up with more than 2 million dead Americans if we did that. And that's just dead people. That's not to mention the other issues from COVID, which blood clots, heart problems. And so we do not want to get to herd immunity through natural infection if we can help it. That process also would take years, and so we would be dealing with economic hardships over and over again as you dealt with shutdowns to keep the hospitals from overflowing. And so that would be a painful process, both emotionally as well as economically. So we want to get to herd immunity through giving people the vaccine. And in order to achieve that, you have to have both a good vaccine and people willing to get the vaccine. And so if we only had 50% effective vaccine, it's better than nothing, but honestly, it probably wouldn't be enough to achieve herd immunity and to stop outbreaks from happening anytime soon. If we had a 70% effective vaccine, that would be pretty good. If most of us in the country got that vaccine, then that may be enough to establish herd immunity. If we have a 90% effective vaccine, then obviously that's even better. I would still encourage everyone to get that vaccine, but if there were a few holdouts, then we could still possibly achieve herd immunity if the majority of us were to get that vaccine.
That's the best explanation I've heard. It's not just a simple thing, just waiting for enough people to get it so that we build up a resistance. A couple of these questions coming in, I'm not sure, and you just tell me if you're not the person to answer them, but person wants to know if they'll have to pay to get the vaccine when it comes out.
So the easy answer is no. Of course, the real answer is more complicated. The vaccine itself I'm sure will be covered. It is in everyone's best interest to get as many people as possible this vaccine. So I am sure it will be covered. There should be some agreements too, since some of the funding for the development and production of the vaccines has come from the government, that people should be able to get them. The problem is, of course, there's more than just the vaccine. There's the needle and the syringe and the nursing time to give you the vaccine. Those things also are commonly billed for. But I am very, very confident that any charges would generally be small and the insurance companies would cover it. I also would assume that in uninsured folks, a lot of those fees could be waived just so that we could get people immune. So I do not expect having to pay any money out of pocket to get the vaccine. But it is more complicated because of all those other factors. So there will probably be several charges on the bill when you get the vaccine, but I don't think the individual patients will pay that.
A related question here. Can I pay to move my, I guess, to move up on the list of when you will get a vaccine? You say the shots will roll out first for people on the front line. If I'm not one of those persons, can I spend the money and get a vaccine earlier?
That would be unethical. I assume it's possible, but I wouldn't want to trust anyone to give me a vaccine that was willing to take money for it. They might give you a saline injection. So yeah, I think the states are going to be responsible for distributing the vaccine. They're going to have some pretty specific rules. They already have the tiers established for who should get the vaccine first. I think those are all reasonable. I'm not going to be one of the first people to get it, so I will also be in line. Honestly, I think that should be fine because these other folks are in much higher need than me. So I think we just need to be patient, and it doesn't matter how much money you have. COVID doesn't care about how big your wallet is. We're getting through this. The end is in sight. We'll get there in a few months.
Yeah, folks, let's do this together. Let's approach this on a unified basis and take care of each other. The people that need the shots first are going to get them first. I want to be respectful of your time when we're running up against the hour. A lot of these questions have to do with timing. When are things going to get back to where we can be out without masks, where I guess we won't have the same normal, but new normal? And when are things going to calm down, in your opinion?
So I think probably summer. We can see the light at the end of the tunnel. It's definitely visible now, but back in March and April, it was just a teeny speck in the distance. But we're getting close. It's even though you may hear on the news there is some disappointment with the amount of the Pfizer vaccine that will be available. The Moderna vaccine looks just as promising. It's going to be easier to distribute as well. So it's not just going to be a single vaccine on the market. I think we're going to have several options. Different places may get different vaccines. I don't have a minus 80 fridge here at our office, and I don't anticipate getting one. So we could store the Pfizer vaccine on dry ice for a few days. But I mean, honestly, for distribution purposes, it would be far better for my office to have the Moderna vaccine. If it's just as good as the Pfizer vaccine, then I assume we will be having multiple options that should be pretty equivalent. I think we're going to start seeing the vaccine for most of us in the spring. Hopefully, if everyone's on board, a lot of us get the vaccine, then by summer, things will be getting warmer. A lot of us will be immune. Things will start to calm down again. I mean, I don't think things will be normal, but I think things will at least start to be recognizable.
Now, again, folks, there's help on the horizon. David, you provided us with a lot of good information, both during this broadcast, and you provided us with some important links earlier that we've scrolled across the bottom of the screen here as we've talked. Again, for our viewers, this information is available on our Facebook page and on our firm's website. If you know other people that would benefit from this, please refer them back here. David, I want to give the opportunity before I close. Is there anything important that I missed that you want to touch upon for our viewers?
No, I think it's just think of yourself and everyone around you. Of course, if we can all just continue to be as careful as possible, look forward to next year. Don't focus on how dreadful things are right now, but we do have the ability to slow the progression and to actually save lives. And so if we can wear the mask, try to keep our distance, just follow the general CDC advice, which has been pretty much the same since March, then we can do this. It's just we have to have the will to do so. And I think now that we can see that the vaccine is almost here, the end is coming. Now is definitely not the time to let up. I think let's all get to that finish line. We're getting close. Just continue to be as careful as you can.
David, I don't want to overdo it, but we are thankful for folks like you, specifically folks that are working in the intensive care units, nurses and doctors, people that I know have been at this for a long time. We appreciate all of your hard work. You folks are really heroes right now. I really appreciate you taking the time to join us today. Folks, we'll be back here next week. We will continue these Facebook Live episodes every Wednesday at 1 o'clock Central Time. Please refer your friends back if you think this information will be helpful. Thank you for the people that have joined in today. On behalf of David, on behalf of all of us at Bond & Bodas, stay safe, and thank you for your time, David.
Thank you.
Bye-bye.